So the polycystic ovarian syndrome is an abnormality that a lot of women have, and the commonest form it manifests is menstrual irregularity. Now, instead of the woman's ovaries developing one egg, which would release or ovulate, they develop multiple tiny eggs, and they are all trying to develop at the same time, and none of them really get to the big size and then releases. And as a result, the hormonal changes that are supposed to follow the release of the egg to lead up to the menstruation or fertilization for pregnancy, those fail to happen. And so the woman will have the period this month, 2, 3, 4, 5, 6 months, no flow, then it comes again. And sometimes because of the break, when it's coming, it comes a lot more heavy and for a more number of days than their usual. Occasionally, it can also make the woman unable to conceive because they are not ovulating. In about 10 women with this condition, 6 to 7 may be able to conceive without any assistance, but 3 to 4 would require some medication or occasionally some minor surgical procedure to make them able to ovulate for pregnancy. Typically, the woman with this condition, they tend to have a little bit of male features. They tend to be a bit more hairy. They are hairy on the arms, the legs, on the chest, and the tummy, and occasionally they have beard. They tend to also have some skin problems like acne, pimples, a lot of that. And when they put on weight, the weight gain makes the condition worse. So then we encourage them to lose 5 to 10% of the body weight and things get better. Dietary advice is part of dealing with polycystic ovarian syndrome. Weight management, avoiding a lot of animal products, meat, egg, cheese, and all that, as well as keeping a healthy balance. If they grow a lot of beards, we encourage them to wax it, and sometimes there's a need for clinical psychological interventions. Polycystic ovarian syndrome can be a risk factor for the woman to develop cancer of the inside of the womb later on in life, or high cholesterol problem, or diabetes type 2, which happens after age 40. So if somebody has polycystic ovarian syndrome or all of these features, they are people who need close follow-up on their blood sugar, their blood cholesterol, and then to give treatment to make sure they have regular menstrual flows in order to minimize the risk of cancer of the inside of the womb. PCOS has solutions. So if you have that problem, you don't sit back at home with it, seek care, and so we can solve it and prevent other complications later on in life.